Hello everyone. In today's session, we'll see about neurological disorders and assessment. In that topic, a specific topic called stroke and its causes and effect. Today, we'll learn about these things. Okay. Many of us know what is stroke and what it could cause and how it occurs. So, we have seen many people with stroke, one side paralyzed people who cannot do their daily routine properly and they need someone to cross their days. So, this is also that kind of disorder. So, now the stroke is nothing but it is happening when the blood supply to the brain is suddenly stopped or reduced. So it is a condition where your brain doesn't get enough blood or it abruptly stops supplying blood to the brain. And without blood, how the brain will get oxygen and your brain cells starts to die. So this leads to a condition called stroke. So the other name is a cerebrovascular accident. Okay. Okay, now we have so many types of strokes. Now we'll see ischemic stroke. So ischemic stroke is nothing but it's most common where every people like neurological disorder people gets ischemic stroke. 70% of the neurological patients get ischemic stroke. So this is nothing but blood vessels in the brain has a blood blockage where there is a block in the blood vessels of a brain is called ischemic stroke. In ischemic stroke, we have two specification conditions that is thrombotic stroke and embolic stroke. Thrombotic is nothing but a clot in artery where brain and heart is connected. So embolic stroke is nothing but clot travels from another part like from brain to heart. So in that way, when they have any traveling difficulties or clots, that is embolic stroke. And next comes hemorrhagic stroke. So here nothing, there will be not any block in the blood vessels of the brain. There will be an internal bleeding in your brain. So that condition will lead to a stroke. That is hemorrhagic stroke. So in that we have two specification conditions that is intracerebral hemorrhage and supracorner hemorrhage. So here bleeding within the brain tissues that is intracerebral hemorrhage and subarachnoid hemorrhage is nothing but bleeding in space around brain that is within the brain and this is around the brain. That is the difference between both the and next, third type of stroke is it is also called as mini stroke attack. That is like a mini attack. So it is a temporary blockage of blood flow in the brain. It may be cured within the short period of time, but you will be having a very severe symptoms. And your warning signs will be a future stroke. This signs will give an future stroke for sure. So now what are all the causes or risk factor that leads to a stroke? That is called major causes. High blood pressure, where high blood pressure turns into an hypertension turns into a neurological conditions, and these neurological conditions leads to a stroke. And next comes to diabetes. So diabetes also relating to and we all know that it is a blood conditions. And next thing is smoking, excessive smoking, high cholesterol, heart diseases, obesity, and lack of exercise, stress, and alcohol use. Yeah, we know every conditions relating to blood and blood vessels that affects and leads to a stroke. Next comes to clinical features. So clinical features here is nothing but we need and clinical symptoms that is to be diagnosed as it is a stroke disorder. So those kind of clinical features or symptoms are for stroke is sudden weakness or numbness, especially one side of the body parts or one particular organ in the body and difficulty in speaking, slurred speech, their tongue will become very thickened and their taste buds will not be working, and loss of visions or blurred visions. Their vision will be lost and their vision will be blurred, they can't see properly, and these kind of symptoms will be there. And severe headache, if they're having hemorrhagic stroke like internal bleedings, they'll be having severe headache without any conditions. So hypertension patients will be getting this severe headache and dizziness and loss of balance. Suddenly a person will be not able to stand in their particular posture, and also it causes to dizziness like fainting, etc. And confusions are difficult to understand, they'll be not giving a clear picture about any particular concepts or particular thing, they'll be very confused. And this is exactly what happens in the brain during a stroke. So first, your blood supply to the brain vessels gets reduced or stopped. Your cells begins to die within minutes. It leads to a loss of functions in the affected area of your brain, and brain cells gets dies due to lack of glucose and oxygen. And how does it affect your brain and behavior? So when your brain affects it, when your brain is under in these harmful condition, it gives physical effects like paralysis, weakness, difficulty walking or coordinating, and cognitively you will be having a memory loss, poor attention and concentration, difficulty in problem solving. Language affects, yeah, obviously it affects our communications also, like aphasia, see difficulty speaking or understanding, sluttered speech because of thickening the tongue. And emotional psychological effect, so emotional psychological effect is leads to depression, anxiety, personality and behavior changing, and emotional changes and everything, instability. And now, what should we do? A patient under stroke is treated, but it is not curable. So they give, when their body parts getting paralyzed, their face and then the hand, legs, and everything will be get wilted, twitched. In those conditions, we'll be having for physical treatment. They'll be having physiotherapy, where it improves our body movements and postures. Speech therapy, as we have slurred speech and thickened tongue, it helps to uh, mm, regulate our speech or communications through speech therapy. And occupational therapy, and occupational is therapy nothing but where our daily activities are trained again to rebuild their life. And psychological support and counseling to uh, build their resilience. Next, how can we manage or treat stroke patient at home or hospital? So immediately we need to seek and medical care if they are having any issues like this or symptoms like this, and they have to follow medications they prescribed by doctors. If need like internal bleeding, they need surgery, and control of their sugar, cholesterol and blood pressure or hypertension, whatever it is. And how can we prevent a stroke? So when we keep in control our body levels like BP, diabetes, and everything, when we keep in under control, the stroke can be controlled. And healthy diet and regular exercises can also helps you to prevent those kind of disease called stroke. And avoid smoking and alcohol. So smoking patient is most vulnerable to get those stroke. Regular health checkups. So monitoring your body internal function is very, very, very important to prevent stroke. So we can diagnose stroke through CT scans or MRI and blood tests, neurological examinations through neurological batteries and angiography to identify the clots. So what is the difference between stroke, seizure, epilepsy? Seizure is one-time abnormal activity, we'll see in next session. And epilepsy is repeated of seizure, chronic condition of seizure leads to epilepsy. Stroke is nothing but blood flow in the brain. So in next session, we'll see about seizure and its effects. Thank you.